There's a pill sitting in your medicine cabinet right now that may be silently eroding your memory. It's not a new drug. It's not experimental. In fact, you've probably taken it dozens of times, maybe just last night to help you sleep. What if I told you this everyday medication has been repeatedly linked to cognitive decline, memory loss, and even dementia? This isn't a fringe theory. It's backed by decades of research, large-scale population studies, and international health warnings. Yet these drugs remain on pharmacy shelves, prescribed and purchased without a second thought. The real danger: most people have no idea which medications are increasing their risk or that there are safer alternatives available. If you're over 40, your brain is already facing natural age-related changes. Add in the wrong medication, and that decline can accelerate faster than you think. The worst part: it often starts with symptoms so subtle they are brushed off as normal aging. In this video, we'll walk through exactly which drugs pose the highest risk, how they affect your brain, and what you can do, starting today, to protect your memory and long-term cognitive health. Make sure to subscribe to the channel so you don't miss the next video in this vital brain health series. Anticholinergic drugs are not a single type, but rather a broad class divided by purpose, strength, and generation. First-generation antihistamines like diphenhydramine are commonly found in allergy or sleep medications, while antispasmodics such as oxybutynin target the bladder. These drugs vary widely in how strongly they affect the brain, which makes their classification especially important for older adults concerned with cognitive health. The strength, or potency, of these drugs refers to how tightly they bind to muscarinic receptors in the nervous system. High-potency agents are more likely to cross the blood-brain barrier and disrupt memory-related pathways. Low-potency agents, while still potentially harmful, tend to stay peripheral. That's why understanding whether a drug is central or peripheral acting becomes a critical distinction when considering long-term use. Anticholinergics are also categorized by clinical intent. Some are prescribed for depression, others for gastrointestinal issues, Parkinson's disease, or urinary symptoms. Yet many of them share a hidden side effect: the ability to cause memory problems, especially when used repeatedly or over long durations. This overlap across specialties is what often leads to unrecognized polypharmacy in aging patients. For clarity, visualizing these drug types in a tree diagram can help, with anticholinergic drugs as the root, branching into first-generation antihistamines, bladder antispasmodics, tricyclic antidepressants, and others. Each of these branches contains specific names: diphenhydramine, oxybutynin, amitriptyline, that are still widely used despite cognitive concerns, especially among the 40-plus population. Anticholinergic drugs work by blocking muscarinic receptors, which are key to communication within the nervous system. There are 5 types, M1 through M5, but M1 is most critical for memory and attention. When these receptors are blocked, the transmission of acetylcholine, a neurotransmitter vital for learning, becomes impaired. This disruption can trigger cognitive symptoms, especially in individuals whose brain resilience is already reduced by age. The hippocampus, the brain's memory center, is particularly sensitive to M1 receptor blockade. When drugs like diphenhydramine interfere with these pathways, they slow down how new memories are formed. Similarly, the prefrontal cortex, which governs decision-making and attention, can also suffer functional decline. These effects may not be immediate, but with continued exposure, they become harder to reverse. Many of these medications are designed to act systemically, but their unintended reach into the brain is where problems begin. Lipophilic drugs cross the blood-brain barrier more easily, raising the risk of central nervous system side effects. This pharmacokinetic detail is rarely discussed during routine prescriptions, yet it plays a major role in long-term brain health. Ultimately, the brain operates on a delicate balance of signals. Interrupting acetylcholine activity, especially in key regions, can set off a cascade of problems. It's not just about memory lapses, it's about shifting the brain's chemistry in a way that accelerates decline. This is the hidden cost many users never see coming: Short-term use of anticholinergic medications can lead to noticeable mental fog, even after just a few doses. Patients often report confusion, difficulty focusing, and trouble remembering recent events. These effects are more pronounced in older adults, whose brain chemistry is naturally more vulnerable. What feels like a minor side effect can be an early sign of deeper disruption. Delirium is another acute concern. Hospitalized patients receiving anticholinergic drugs may become disoriented or agitated, especially at night. This temporary confusion is sometimes mistaken for psychiatric symptoms or dementia, delaying proper diagnosis. Caregivers and medical staff must stay alert to these reactions, as they often subside once the drug is discontinued. Over time, repeated use creates a chronic environment of reduced neuroplasticity. The brain becomes less efficient at forming new connections, and this leads to a slow erosion of mental agility. Long-term users may not notice the decline at first, but subtle memory lapses can become more frequent, affecting daily life, relationships, and work performance. The pattern of memory loss linked to anticholinergic exposure often mimics early-stage dementia. Difficulty recalling names, managing finances, or following conversations are common complaints. Without awareness of the drug's role, these symptoms may go unchecked until significant damage has occurred. That's why early recognition and action are key. Large-scale studies have consistently shown a link between anticholinergic use and cognitive decline. One well-known cohort study from the University of Washington followed over 3,400 adults for more than 7 years. It found that individuals with high cumulative exposure to anticholinergic drugs had a 54% increased risk of developing dementia, even when controlling for other variables. Case control studies have echoed these results. In one British analysis involving nearly 300,000 participants, researchers found that those who used anticholinergic antidepressants or bladder medications had significantly higher odds of receiving a dementia diagnosis later in life. The data indicated that the risk intensified with both dose and duration, suggesting a dose-response relationship. Meta-analyses offer a broader view, compiling findings from multiple studies to reveal overarching trends. A 2022 meta-analysis published in JAMA Neurology reviewed data from over 700,000 subjects and concluded that the overall risk of dementia rose by 20 to 30% among chronic anticholinergic users. These studies use statistical tools like confidence intervals and relative risk ratios to strengthen their conclusions. Despite some variation in methodologies, the message is clear: long-term exposure to anticholinergic medications is not benign. Population studies offer not just numbers, but a warning, one grounded in real-world patient experiences. Ignoring this evidence may come at a cost that cannot be revised later. The effects of anticholinergic drugs build over time. That's where the concept of anticholinergic burden comes in, a cumulative measure that reflects both the dosage and duration of use. The anticholinergic cognitive burden, ACB, scale helps clinicians quantify this risk. A score of 3, for example, indicates high cognitive risk and is often assigned to drugs like oxybutynin and amitriptyline. Many patients unknowingly accumulate high ACB scores by combining multiple low-risk medications. A sleep aid here, a bladder pill there, each seems harmless alone, but together they can tip the balance. This silent accumulation is one of the reasons why memory complaints sometimes emerge without a clear medical explanation. Studies show that prolonged exposure increases the likelihood of cognitive decline, particularly when the medications are used daily for 3 years or more. The risk does not drop immediately after discontinuation, suggesting that some neurological changes may be irreversible. That's why early recognition and tapering are crucial. It's not just about the amount taken, but also the vulnerability of the individual. Older adults with slower metabolism or pre-existing cognitive issues are more susceptible to the damaging effects. The cumulative burden becomes a compounding problem, pushing the brain toward degeneration without obvious warning signs. Research has uncovered how anticholinergic drugs may contribute to the underlying processes of neurodegeneration. One key mechanism is their role in promoting amyloid beta buildup, a toxic protein associated with Alzheimer's disease. By disrupting acetylcholine pathways, these drugs appear to impair the brain's natural ability to clear harmful waste, leading to plaque accumulation. Another pathway involves tau protein phosphorylation, which destabilizes the structure of neurons. In a healthy brain, tau helps maintain cellular transport. But under the influence of chronic anticholinergic use, tau proteins become tangled, a hallmark of several forms of dementia, including Alzheimer's and frontotemporal dementia. These changes affect memory, mood, and executive function. In some cases, anticholinergic exposure can unmask or accelerate Lewy body dementia, a condition known for visual hallucinations and fluctuating cognition. These patients are especially sensitive to drugs that interfere with acetylcholine. Even small doses can provoke rapid mental deterioration, highlighting the need for cautious prescribing in vulnerable populations. Vascular contributions also matter. Anticholinergics may affect cerebral blood flow and reduce oxygenation to critical brain areas. Combined with existing risk factors like hypertension or diabetes, the damage can be multi-layered. This explains why cognitive decline often involves more than one pathology, and why drug-induced harm is not easily undone. Health authorities across the globe have issued formal warnings about the risks of anticholinergic medications in older adults. In the United States, the BEAS criteria lists many of these drugs as potentially inappropriate for seniors, urging physicians to reconsider their use. Diphenhydramine, for instance, is flagged for its strong anticholinergic effects and high likelihood of causing confusion and memory loss. In Europe, the Stop-I-Start criteria offer a similar framework, advising against prolonged use of anticholinergic drugs unless absolutely necessary. These guidelines are widely adopted in geriatric care and help practitioners avoid prescribing cascades, where one medication causes side effects that lead to even more prescriptions. The aim is to minimize harm while maintaining symptom control. The UK's National Health Service, NHS, has also implemented digital alerts in electronic medical records. These flags notify clinicians when a high-risk drug is prescribed to someone over 65. In some systems, alternatives are suggested automatically, prompting the doctor to review safer options. This integration of decision support into daily practice reflects the growing concern over cognitive risks. Despite these safeguards, many patients continue to receive anticholinergic prescriptions without a full understanding of the consequences. Not all healthcare providers are equally informed, and guidelines vary in how rigorously they are enforced. That's why public awareness and proactive questioning remain essential for those concerned about brain health. When it comes to protecting brain health, safer alternatives to anticholinergic drugs are available, but they require deliberate planning. For bladder issues, medications like mirabrine offer symptom relief without affecting brain receptors. For sleep problems, non-drug approaches such as cognitive behavioral therapy for insomnia, CBTI, have proven effective and carry no cognitive side effects. Deprescribing is another key strategy. This process involves gradually reducing and eventually stopping anticholinergic medications under medical supervision. Sudden withdrawal can cause rebound symptoms, so tapering is critical. Clinicians often use structured protocols to monitor progress and adjust the plan based on the patient's response. Behavioral and lifestyle interventions also play a vital role. Techniques like bladder training, dietary adjustments, and exercise routines can reduce reliance on medication. In cases of depression or anxiety, newer antidepressants with minimal anticholinergic properties may be suitable substitutes. The goal is to treat the condition without compromising cognitive health. Regular cognitive monitoring should accompany any plan involving long-term medication. Tools such as the Montreal Cognitive Assessment, MoCA, or Mini-Mental State Examination, MMSE, help track changes over time. By combining alternative treatments with consistent follow-up, patients and physicians can work together to preserve both function and quality of life. Join our channel's membership program today to stay ahead with exclusive updates, expert interviews, and in-depth content on protecting your cognitive health. Don't wait until symptoms appear. Start acting now. If you've been using anticholinergic medications without realizing the risks, now is the time to reassess. Talk to your doctor, review your prescriptions, and consider safer options. Your brain doesn't have a backup drive. Every decision you make today shapes your clarity, memory, and independence tomorrow. We're not just talking about minor forgetfulness. We're talking about long-term brain function, your ability to recognize loved ones, make decisions, and stay mentally sharp as you age. That's worth a serious conversation. Wouldn't you agree? If this video gave you a new perspective, leave a comment below and tell us which medication surprised you the most. Don't forget to like, share, and subscribe to support this channel. Your awareness might be exactly what someone else needs.